Welcome to Channel 17's Health Roundup series with St. Anthony Granby Medical Center. I'm Jody Mintkin, and we're here today with Dr. Tim Bolander, Medical Director and Family Practitioner here at Granby Medical Center. Today we are going to talk about allergies. So Dr. Bolander, tell me, what are the common allergies that you see up here?
Well, allergies are a real problem for a lot of people. We probably have fewer issues here than we do other places in the country. We don't grow as many weeds and molds as we do some places. It's a reaction that people have to allergens, pollens, that sort of thing. So it would be things early in the season that we would see tree pollens and things that are carried along with pine pollen that we see here commonly. People will get out and get these things on their skin and their nose, their eyes, and it causes some real common symptoms with watery eyes, red itchy nose, clear nose running, that sort of thing. We also see problems with molds, not so much here again as other places, though it's more in bathrooms where we have a lot of water problems if there isn't enough air circulation. So that's real important to control that. Pets are another source. We get outside, get around cats, dogs in the house, or outside around horses, cattle, that sort of thing. And a lot of people will react to that. It's skin cells and danders that are proteins that people will touch or breathe in and cause a lot of problems with, again, hay fever, what we think about as hay fever, kind of common eye and nose irritation as well.
Are some people more apt to have allergies than others? How does that work? Is it hereditary?
You know, it certainly can be. People, it varies over their lifetime. And a lot of times children that start out with severe allergies or asthma will grow out of a lot of it. It affects children and adults a little differently that way, but a lot of the hay fever symptoms are pretty common. There is a family tendency to have that. People with very light skin, light hair, tend to have more allergic problems.
Interesting.
Mm-hmm.
And how can allergies be avoided?
Well, you know, a lot of it's prevention, really avoiding things that you know are going to bother you. I think that during haying season up here is a time when people really have problems, or when the pine pollen is really active. And I think that trying to avoid those times, you know, when you know something's going to bother you, we really need to keep our bedrooms very sterile, if you want to call it that. And be careful not to have windows open at night, because a lot of pollen floats around at night and will lay on people, on their bed clothing and things. And using HEPA-filtered vacuums, I think, makes a big difference. So keeping bedrooms without pets and windows closed really will help a lot.
Mm-hmm. Well, thank you so much for the information, Dr. Bolander. We really appreciate it. And thanks for watching St. Anthony Granby Medical Center's Health Roundup series on Channel 17. Stay tuned for more.